Hello, my name's Lizzie Anstey. I'm a community midwife and the team leader for Bodmin, St Austell and Weybridge Midwife. I work mostly at Penrith Birth Centre in St Austell, so I may look familiar for any of you who have care there.
Hi Lizzie, it's really lovely to talk with you. We've had lots of families asking questions, and one of the frequent questions is, what appointments can families expect to be having with you?
Okay, so that's a really good question. So our schedule of appointments has lasted kind of mainly the same. However, we are trying to minimise the time of contact that we're having with you for your safety and ours. So any appointments that would usually be slightly longer, we would try and do a portion over the phone and then a short face-to-face contact for any clinical tests. So for example, your first booking in appointment between 8 and 10 weeks of pregnancy, we would call you prior and take the majority of information over the phone and then see you for a short appointment just to do a blood pressure, urine, height and weight and some blood tests if you were happy to have those. Additionally, a birth plan at 36 weeks would usually be done mostly over the phone, and then a short appointment for your normal antenatal check. There has been a slight change to the schedule of appointments between 30 and 36 weeks. We now have a 32-week contact for everyone, rather than a 31-week contact for a first-time mum and a 34-week contact, and just a 34-week contact for if you're having your second or subsequent baby.
And what can I expect my community midwife to be wearing in terms of PPE?
So we're all wearing full PPE for all direct patient care, and what that means is a pair of gloves, an apron, and a mask. And if there was any kind of risk of bodily fluid splashing, so for example in labour, we would also wear eye protection.
And how about video calling?
So we're definitely encouraging women to video call their partners when they're having their appointments. We really want to keep partners involved as much as possible, and we're really sorry that we've had to ask you to come to your appointment alone. So your midwife will support you to FaceTime or record or take photos during your appointment, whatever works for you.
And then you were talking a bit about birth plans. Is there anything else that you'd want to add in terms of having birth plans for women?
Yeah, so birth plans are really important, and obviously some women really like to make a birth plan and others not so much, and what we would say is that it's not so much a contract, but it's a process of you getting informed about what your options are. So when we talk about writing a birth plan, we're not saying that we're going to kind of write a story and that's exactly how it's going to go, but we want to talk to you about what might happen through the process so that you're as informed and prepared as possible, and we will offer you that at around 36 weeks. Personally, I feel that now birth plans are even more important than ever because lots of things are changing, so it can be really reassuring for you to have time to go through all of the options with a midwife, and like I said, that will mostly be done over the phone, and then kind of a follow-up appointment for your normal antenatal check. There's also some links that we can share with you to help you write your birth plan, so if for whatever reason you don't access that with your midwife, you can have a look online.
And what are our options for giving birth in the community at the moment?
So in Cornwall we're really lucky that we actually have 3 freestanding birth centres, and alongside birth centre and the option of home birth still available to you. So there's a birth centre on the Isles of Scilly, in Helston, and also Penrith Birth Centre where I work, and we have Truro Birth Centre as well, and all of those options are still available during kind of the COVID pandemic, and we very much encourage you to consider those options as well, because we know that there are a lot of benefits of you choosing to have a community birth, and you're much more likely to have a normal birth if that's what you want. So they're very much open. The same rules apply in terms of birth partners as the hospital. So we would still ask you to come with your birth partner in labour, that's absolutely encouraged. And if you did choose to stay after the birth of your baby, then we would ask your partner to go home at that point. So usually you would stay in the room that you give birth in for around 2 to 6 hours. And then if you wanted to stay, we would transfer you either to the postnatal ward or to the postnatal rooms at Penrith. And in that case, then we would ask your partner to go home. And in terms of any kind of PPE that we would ask you to wear, the midwives will be the ones wearing PPE and you wouldn't be asked to wear anything, unless of course you had symptoms, in which case we would ask you to wear a mask, and recommend that your care was at Trelisk Delivery Suite.
Hello, I'm Helen Ettle. I'm one of the community midwife team leaders. I mainly cover the Camborne, Redruth and Truro areas, and I just wanted to talk a little bit about our home birth service because we've had lots of questions and lots of anxieties being raised. So I just want to reassure everybody out there that we are absolutely passionate about our home birth service in Cornwall, as we always have been, and that it's ongoing and that we're doing our very best to facilitate everybody that wants a home birth, as we always do. If mum is symptomatic before she has a baby when going into labour, i.e. has a temperature, a cough, or is generally unwell, our advice will be when you ring the triage line that you need to have your baby in hospital. That is so that we can monitor you, but also monitor baby after birth as well. So that's a really important piece of advice that we need to get out there, is that if mum has got any clinical symptoms, she needs to be having a baby in hospital and not at home or in a birth centre. When we come to your home, we always have 2 midwives at a planned home birth, and we will do a risk assessment with you at around about 36 weeks, as we always do, when we'll talk to you about what room and area in the house you'd like to have your baby in, whether you're planning a home water birth, and we're asking that at your home birth, you only have yourself, your one birth partner and the midwives in that room with you for the duration of your care and your birth. So we need to think about a room where you want to actually deliver your baby that's close to a kitchen and a toilet or a bathroom. Now, it may well be that you've got other children in the house and you need somebody to come in to be looking after the children, which is absolutely fine, but we do ask that they can maybe stay in another part of the house whilst the midwives are giving you your care and delivering your baby. Then after that point, when the midwives go, obviously you'll all be reunited back as a family again. When we do the home birth risk assessment, we look at lots of issues around where you're going to have your baby, and we always consider ambulance transfer because we never know that anybody might need an ambulance transfer. So we have to make sure everything is safe, that an ambulance can access your house, that we're not having to go down 3 flights of rickety stairs or anything like that. So we need to make you in the safest part of the house as possible to have your baby. We will be wearing PPE throughout the whole of our care with you at home, which is an apron, gloves and a mask, and we'll put on some eye protection just for the actual delivery of your baby, which may be a visor or some goggles. In Cornwall, we're working with the continuity of carer model, which a lot of mums will be well aware of, and you know your midwife and you meet her regularly through all your antenatal care. We're aiming at your birth that you will know or have met at least one of the 2 midwives that will be there at your home birth delivering your babies. And indeed, hopefully, if you're having some of your babies in the birth centres, you again will know at least one of the midwives that's there with you.
Hello, I'm Sandra Hogan. I'm one of the community team leaders for midwifery in Cornwall, and I look after the West team and the Isles of Scilly. And I'd just like to talk to you a little bit today about what happens if you have a community birth, so either at home or in one of our birth centres, and you need a transfer to hospital by ambulance. So I'll just go into a little bit of the detail what happens. So the midwife will call the ambulance, and I'm very pleased to say we're well supported by the ambulance service, and we usually have a very quick response from them to come and assist you and take you to hospital. And you would come to the delivery suite at Trelisk, and you'd be accompanied in the ambulance by a midwife, and it would usually be one of the midwives that has been looking after you in labour and the birth. So sometimes a mum needs a transfer to hospital, maybe after the birth of her baby, and if this is the case, then she would go in the ambulance, and we'd recommend that dad or partner follows on behind in the car with the baby in the car seat to ambulance, and then reunite with mum once you've arrived. Don't forget, it can be useful to have a car on site at the hospital and your car seat, because you're going to need it when you're well and can come home again. It may be that baby has a slight problem and needs to be seen in the hospital, that would require an ambulance transfer, in which case an ambulance would come for the baby, and if mum is well enough, then mum can go in the ambulance as well with the baby. However, if mum is unwell or is not able to leave the home at that point or the birth centre, then a separate ambulance will be sent for mum, so mum and baby could travel in separate ambulances, and then Dad follow in the car and you all meet up at the hospital. So as you are aware, we're having to be very careful, unfortunately, about dads and partners coming into the hospital, and visiting is restricted to one birth partner. However, once you come into hospital after coming in by ambulance, your partner can stay with you on delivery suite until you're either well enough to go home or go to the postnatal ward afterwards. Just to highlight to you about our team social media pages, we have Instagram pages, Facebook pages, and we're using these platforms to give you as much of information at this time that we can about how we care for you, about what's available, about how we can get all the information to you that you might need to help you plan your care and inform you of events as they unfolding. Don't forget, we have the antenatal online classes which are linked via our social media pages, which is a good resource for you, so you can get information that we were previously providing at our bump to baby classes, and that's online now for you to access. After you've had your baby, we continue to look after you for the next few days and weeks for your postnatal care, and we individualise that according to how your birth has gone, what your needs are, what your health concerns are at the time. So it's all adapted to your needs. You have a phone call the following day after your baby's been born and after you've come home from hospital or after the birth of your baby, and that'll be from a midwife who'll do a really thorough chat with you over the phone and plan your care from there on in. We see you then 5 days and 10 days as a minimum, but we also have a fantastic team of maternity support workers and an infant feeding team, as well as the wider midwifery team who can give you extra help and support, not only with feeding your baby but with your emotional support, to just give you wraparound care as far as we can, just to make you feel that you're being looked after during this time. We will see you on day 5 and day 10, and we will weigh your baby on both of those times, day 5, day 10, and the baby's newborn screening test will be completed round about day 5. So that hasn't changed. We're still looking after you and doing the same pathway of care as we would have been had we not been in these times. And finally, I'd just like to reassure you that don't be alone with your worries and concerns. Don't stay at home if you need to speak to somebody, if you've got a concern, something that's on your mind, something you're worried about. We have our 24-hour triage line, which is there for your support as well as clinical advice, and we hopefully can reassure you and answer your queries via that line. We're here for you, and we know this is a really difficult time for you, and we just want to support you.